Freddie is 4.5 years old now, a very entertaining, lively young man. We live over in Kettering, so in Northamptonshire. So coming up to Manchester has been, it's a big investment of time for the whole family. What small boy doesn't like getting 2 trips a day on a train? He was diagnosed with hemiplegia when he was about 8 months old. So we found we had a very floppy baby that was left-handed, which was a bit unusual. So that led to the diagnosis. This was a bit of a wake-up call and a shock to the system and really changed our lives quite considerably. We then learned a lot about the condition, about cerebral palsy in general, and how to best advance Freddie and give him every chance in life that he deserves. Our local physiotherapy team effectively wrote it off. It's never going to get anywhere. So that's when we started looking around for alternative therapies or different approaches. A lot of Googling, talking to people, and recommendations led us to CIMT.
Freddie had a complicated birth and has global developmental delay, meaning that he reached all his milestones later than the average child. At 7 months old, Freddie was diagnosed with having right-sided hemiplegia. Since Freddies Last CIMT programme, he has made some significant changes in his function. By the end of the 4-week programme, our aim is for Freddie to independently maintain pincer grip and to increase his supination in his forearm. Freddie has come to complete a 4-week CIMT programme today. He's come with his parents from Northamptonshire, and it is the 2nd time that Freddie's undergoing a 4-week CIMT programme. Freddie was casted today on day 1. The cast is going to stay on for the rest of the 4 weeks and will be on for 24 hours a day. This is to allow Freddie to focus on his right side without being distracted and encourage him to use it as much as possible. Freddie's dealing with the cast very well, bearing in mind this is his 2nd CIMT programme, and he also practices CIMT at home with his family.
We've tried not to set specific goals in terms of I want to be juggling by the end of 4 weeks or something like that, but rather what we want to see is just a gradual and continuous progress. But what we're seeing is basically he's following his own developmental curve, both in terms of speech, language and general capability, and likewise we're starting to see that curve develop and move forwards in terms of his arm function as well. So from our perspective, as long as there's progress in the right direction and he's seeing benefit and enjoying it, then to us that's a result.
So far, we've been focusing on supination, so we've been doing things like puzzles to encourage Freddie to twist his arm so he can look at the puzzle pieces. We've also been practicing Freddie's pincer grasp by playing with things such as stickers and marbles. Freddie's favourite things to play with are anything to do with cars and trains, so we've been building train tracks, racing cars and using sticker cars. We are halfway through Freddie's 4-week CIMT programme. He's doing very well and seems to be having a lot of fun with us.
We've seen a great deal of improvement in Freddie's arm function. Clearly advanced quite a long way, so we're very happy with the progress that we've seen.
Freddie appears to be a lot more positive towards his right side and is eager to use it in play. He still requires some hand-on-hand facilitation to maintain pincer grip, and this is what we will aim to work on. What Freddie has found most challenging so far is being able to carry out activities involving his hand while at the same time standing or walking. Today is Freddies' last day at CIMT. The cast has come off and we've spent some time practicing bimanual tasks. It's clear to see that Freddie has a more positive attitude towards his right hand and is more eager to use it in bimanual activities. One of the main things that Freddie has improved on is thumb abduction, meaning that he can now hold his thumb in a better, more functional position and is able to hold items of varying sizes. The repetitive task practice that we've done over the past 4 weeks have created neural changes in Freddie's brain, meaning that his improvements will carry over into his daily life.
One of the things that really attracted us to Constraint Induced movement therapy was the fact that it's an evidence-based, metric-informed process. So it's not a subjective assessment of yes, it's a bit better, no, it's not that much better. It's actually using recognised techniques to assess the performance of the arm before and after, such that you can quantify and understand the impact of the intervention that's been made. To our minds, that gives a great deal of value and a great deal of confidence that the progress is being made and can be demonstrated to be made. So on the whole, after effectively 2 years of constraint therapy, both at home and at the clinic, I think we're very happy with the progress that Freddie's made and the improved chances it gives us in life, and it gives us a basis and a foundation on which to move forward. We thoroughly recommend it to anybody. We've seen positive impacts, little things such that even, it's a small thing, but being able to hold a yogurt pot with his right hand whilst he spoons with his left hand, that's a big improvement, so therefore you're seeing some functional gain or some functional benefit from the affected arm. And during the course of the 4 weeks where his good arm is being in a cast, we got to the point where if you put a bit of food on his fork, he's then able to self-feed, which again is a big step forward compared to where we were previously, when effectively the arm was just an appendage at the side of his body. And we believe that in time he'll have a functional helper hand or helper arm, which will really be a benefit to him in later life.